Hi everyone, my name is Allison and I'm presenting on weight bias in nursing. Thanks for watching. The first thing that we have to talk about is what is bias. Maybe this is a term that you're familiar with, maybe it's not, but a bias would be a prejudice or a stereotype or a negative thought or attitude towards a person or characteristic. So everyone has biases, everyone has stereotypes, and it just really depends on your upbringing, your background, your past experiences. So I just want you to take a minute, maybe this is something you've done as an exercise in other classes, but just kind of examine what biases you might have and towards what characteristics. So of course we're specifically looking at bias towards obesity, which, as you'll see as we go through the presentation, is very prevalent. And I think that we're all nurses, so if you do work in healthcare, I'm sure that you've encountered it. It's just very common. So as we go through this, I think just don't be defensive, just kind of examine yourself for that and ask maybe if this is something that you're guilty of or has maybe influenced you, and maybe you just weren't conscious of it at the time. So obesity. Obesity is now labeled as a chronic disease in our nation. So 36% of individuals is the statistic that I found for obesity, and we are seeing those numbers climb. More and more individuals are obese. It's becoming more common. One statistic I saw was that at least every state, 1 in 5 individuals is obese, but I think we can average that to say 36%. So even though obesity is so common, healthcare workers are still continuing to have a negative bias towards obese people. In one study, 31% of nurses reported that they would rather not care for obese individuals, and 24% of them agree that they were repulsed by obese people. So that's some pretty strong language to use towards a people group. So these negative stereotypes towards obese individuals have an impact on the care that we give as nurses, and that's why it's an important issue in nursing. That's why we're talking about it today. So I just want for a moment, I want you to kind of put yourself in the shoes of maybe an obese patient and just think about what that must be like and all the different implications. So we're going to look at it from their perspective. In some studies, there were reports by obese people that just said that just the act of being weighed, like just that's such a routine medical procedure, just being weighed. Think how many times you hit that scale button on a bed each day at work, or you walk in a doctor's office and what's the first thing they do? They put you on a scale. So just the act of being weighed, they were fearful enough of, or it was embarrassing enough that obese people avoid medical appointments for that reason. So 46% of obese women report that barriers to them seeking healthcare are the fact that the gowns are too small, they don't fit. The exam tables in a doctor's office, think about how narrow they are. Can you imagine going in and not fitting on the table, or just being extremely uncomfortable because of your size? Or inappropriately sized medical equipment. Just one example that popped in my head that has happened before when I've been caring for patients is I go to put big gait belts around them, and on some individuals that doesn't fit, and we would have to go and get a bariatric gait belt, and just think about how humiliating that must be for them, and as much as we try to just kind of brush it off and not make a big deal and not make them uncomfortable, it can be difficult to do, and there's so many things like that in the hospital setting, bariatric chairs, bariatric beds, and that medical equipment isn't always readily available, and just the act of having to call and get it, and if the patient's aware that you're going out of your way to get equipment that's specially sized for them, just think about how embarrassing that must be. We were in a conversation, my nurse manager and some coworkers and I, the other day. There was an incident where some people were trying to get a bariatric bed into one of our rooms, and it didn't fit, and they described having to shove it, and my nurse manager was like, just think about how embarrassing that must be for the patient to have to be shoved into the room. So yeah, just realize the impact that has on them. In nursing practice, nurses may think that obese individuals have a lack of self-discipline or a weak will. And nurses have reported that they spend less time with those patients, and that's impacting their care. Those patients aren't receiving the same type of care that persons of a normal weight might receive. In healthcare, this is leading to poor patient outcomes. If obese individuals aren't seeking medical attention or they're delaying it, it's causing problems that might be preventable to go on untreated. And so, of course, that causes a greater burden and cost on the healthcare system. And just in society, if you think about 36% of society being obese and affected by the stigma and we're discriminating against them, that's a social justice problem. That's a huge problem. And again, leading to poor patient outcomes for that 36%. In conclusion, I just want to leave us with this quote that I really appreciated from a nurse. She says, labeling obesity as a treatable disease is a paradigm shift for many healthcare providers and patients. Recognizing its complexity is crucial to improving the healthcare system and processes so that we can provide optimal care to bariatric patients. I know that as a nurse, I want to provide the best care I possibly can to all of my patients, and I don't want to be affected by a stigma against them because of their weight, especially since obesity is such a complex issue, and it's not just, we can't simplify it and stereotype it as we tend to do. So I hope that this has been helpful for you. I hope it just causes you to kind of re-examine yourself and the way that you treat your patients. Thanks for watching.